Hi everyone. It's good to see you all. I'm here at the launch of the Integrated Care Academy to talk about the paradox of focusing least on what matters most, bringing complexity, context and intersectionality back into integrated research. I'm particularly excited to be here at the launch of such a trailblazing institute, not only through its focus on such an important area, mental health and well-being, but also its focus on quality of life, not just during life, but particularly also at the end of life. My name is Alex Clark. I'm talking to you today as a health services researcher from Western Canada, where I'm Professor and Associate Vice President Research at the University of Alberta. And we're going to focus today on this notion that today's path is actually yesterday's path in many ways that we might not consider. I'm going to give you a magic distance here that unites more than what you might think. 4 feet 8 inches. And 4 feet 8 inches is the diameter of the fuel rockets used to launch the space shuttle into space many tens, hundreds of times. How did the fuel rockets get to be 4 feet 8 inches? Was this the idea of the engineers? No. 4 feet 8 inches was the constraint that the engineers had to work with because the fuel rockets had to be transported by train. And 4 feet 8 inches, that's the width of the train tracks between Utah and the launch site in Florida. So how did the train tracks of the United States get to be 4 feet 8 inches? Well, these reflected, of course, the width of train tracks all over the world that had their origin in the United Kingdom, where the train tracks were built on the horse tracks that transcended and weaved through the whole country. And these horse tracks were around about 4 feet 8 inches in diameter. So how did the horse tracks get to be that diameter? Well, actually those tracks went upon Roman roads, built 2,000 years before, that tended to be 4 feet 8 inches in diameter. And this is the notion of path dependency. The tendency for human beings to see problems in the same ways, to draw on old solutions, and then develop approaches that sometimes don't adequately address the challenges of today. And we see path dependency in many areas of life. And I'm going to talk to you today about the old path paradox in the 80% majority of research in health and well-being in 3 main areas. Research that focuses on the same old impacts, that redescribes the same old problems using simple questions and simple study designs. Okay, old path number 1, that we focus on the same old academic impacts. Often in research, we're all saying, we've said for years, that we want to use our research to focus on better healthcare and indeed improved health outcomes. And we've done this by publishing mostly to peers, presenting mostly to peers, and with the outcome of our grants being, other research grants. And this is done far too little to improve healthcare and improve health outcomes. And so now it's timely to chart new paths that recognize not just academic impacts that are important, but social and economic impacts are important too, as reflected in the DORA approach to integrated research assessment from the San Francisco Declaration. And it's encouraging to see the Institute continue that pioneering diversification, moving academic work into social innovations, interventions and technology that potentially not just contribute to healthcare and outcomes, but also reduce and improve economic costs. So old path number 1 we want to challenge is around impact. And we need a new path to contribute diverse impacts. And universities need to not only see and measure these diverse impacts, but they want to reward and support them too. This is the first new path. The second new path. Research needs to stop redescribing old problems. I'm sure many of you are familiar with this kind of research, mainly based in epidemiology, where we just redescribe decade after decade the same adverse mental health and well-being outcomes in the same populations, reporting the same size or even increasing social gradients. And those populations are often described using the same old binary categories: male and female, men and women, middle-aged, old-aged, and very old. We need new paths. We need more intervention research that seeks to solve problems around mental health and well-being, not just in general populations, but particularly in vulnerable populations. And around how we describe those populations, we need to recognize the vital role of intersectionality across these populations. A new path here, focusing on more intervention research, bringing intersectionality avowedly back in. And thirdly, we need to challenge the old path that poses simple questions and addresses these simple questions using simple study designs. An old path characterized by simple questions about does an intervention work or not, uses methods drawn and born from the pharmaceutical industry, using very simple approaches to produce a very simple, unnuanced knowledge, focusing dichotomously on whether an intervention works or not. And the old path is very a-contextualized. It controls for or writes out some of the very factors that determine whether interventions work in the real world or not. So we need some new paths here. We need to address new and different types of questions. What interventions work for whom, when, and why, using more mixed methods designs. And a research base and evidence base that doesn't just write context out, but is in fact context responsive. A new path, bringing complexity and context responsive approaches to research back in. So in conclusion, we need more diverse impacts. We need more intervention research that brings intersectionality in. And we need more research that addresses complexity and complex responsive approaches to research. So well done and good luck to Professor Ski and her team of teams as they pioneer this real trailblazing integrated care academy, making and taking new paths, focusing more on what matters most in these new paths. Thank you. Good luck.